Hi, my name's Darren from Go-To Imaging, and I just wanted to share with a brief case history on the differences on a standard MRI and a dynamic to weight-bearing MRI scan. So here is a patient that I saw some time ago. Let me just share that for you now. And what you can clearly see on this picture, I just want you to look at the left-hand side just here. This is a patient who was 58 years of age and he had suffered sciatica in the legs for a number of years on and off, and it had progressively gotten worse. He'd been to see various therapists and consultants, and there wasn't really any improvement. And he actually lived in Switzerland, and he flew to London. He was here visiting friends, and whilst he was here, he popped into the clinic. And this chap had pain in the leg, predominantly when he was standing, walking, and in particular, extending. Now, he told me that he'd had sciatic pain investigated, and he'd had lumbar spine, thoracic spine, cervical spine. And when all that came back normal, he then went on to have a pelvic scan to see if there was any mass or any kind of nerve root compression there. But everything came back unremarkable. So I want to just show you that when I did my clinical examination, when he was flexing, touching his toes, and when he was sitting, he had no sciatica. But as soon as he stood, he got it. So I thought, right, you've had all the standard testing, imaging, we now need to send you for a dynamic and weight-bearing scan. So on the left-hand side, you'll clearly see that here we have the L5 vertebral body, L5 disc, L4 disc. Now, adjacent to the L4 disc is this area here. Now, this is a parasagittal view, and what you're looking at here is the exit foramina. And I often call this the keyhole sign because it looks like a keyhole. And what you'll see is some high signal surrounding the keyhole, which is perineural fat. And in the middle is a nerve root, an exiting nerve root. And the root in particular here is the exiting L4 nerve root. Now you can clearly see that this disc in question is sitting where it should be, and there is no compression of the root whatsoever. But now jump over to the right-hand side of the screen. This you can clearly see in the heading. It's a standing extension scan. Now look what's happened to the L4 disc. As he stands and extends, he has complete closure of the exit foramina. So that keyhole can no longer be seen. Minor part of the perineural fat, superior and inferior. But you can clearly see he has a dark cartilaginous annular protrusion into the lateral foramina, and that is causing complete compression of the exiting nerve root at that level, and hence why he was getting symptoms when he was walking, and hence why that had not been seen on a static scan. I hope that helps you to understand the differences and what you can and can't see with a functional view. Many thanks.